Obsessive-compulsive disorder, OCD, is a complex and often debilitating mental health condition that extends far beyond the common misperception of mere tidiness or a penchant for organization. At its core, OCD is characterized by a relentless cycle of obsessions and compulsions, intrusive thoughts, and repetitive behaviors that can significantly impair an individual's daily functioning and overall quality of life. Understanding the nuances of this disorder requires a deeper examination of its key components, the impact it has on those affected, and the available avenues for effective treatment. Obsessions, the first component of this cycle, are not simply strong preferences. They are persistent, unwanted, and distressing thoughts, urges, or images that invade an individual's mind, causing considerable anxiety. These intrusive thoughts can take many forms, from fears of contamination or germs, to doubts about having completed essential tasks, or even disturbing and unwanted violent or sexual thoughts. The defining characteristic of these obsessions is their involuntary nature and the profound distress they elicit. Individuals with OCD recognize these thoughts as irrational or excessive, yet they struggle to control or dismiss them. This struggle becomes a constant battle, a mental torment that disrupts their peace of mind. Compulsions, the second component, are the repetitive behaviors or mental acts that individuals feel compelled to perform in response to their obsessions. These actions are not undertaken for pleasure or satisfaction, but rather as a means to alleviate the anxiety caused by the obsessions, or to prevent a dreaded outcome. Common compulsions include excessive hand-washing, repeated checking of locks or appliances, counting, arranging objects in a specific way, or mental rituals like repeating phrases or prayers. While these compulsions may provide temporary relief from anxiety, they ultimately reinforce the obsessive-compulsive cycle, creating a pattern of dependence on these behaviors. The individual becomes trapped in a loop, where the need to perform compulsions intensifies with each recurrence of the obsession. The impact of OCD on an individual's life can be profound. The time spent engaging in compulsions can consume hours each day, interfering with work, school, and social activities. Relationships may suffer as family members and friends struggle to understand the individual's behaviors. Moreover, the constant anxiety and distress associated with OCD can lead to other mental health problems, such as depression and anxiety disorders. It is also important to differentiate between OCD and obsessive-compulsive personality disorder, OCPD. While both involve obsessions, OCPD is characterized by a pervasive pattern of preoccupation with orderliness, perfectionism, and control, without the specific obsessions and compulsions seen in OCD. Fortunately, effective treatments are available for OCD. Cognitive behavioral therapy, CBT, particularly exposure and response prevention, ERP, is a highly effective form of therapy that helps individuals confront their fears and resist the urge to perform compulsions. ERP involves gradually exposing the individual to their feared situations or objects while preventing them from engaging in their usual compulsive behaviors. This allows them to learn that their anxiety will decrease over time, even without performing the compulsion. Medications, such as selective serotonin reuptake inhibitors, SSRIs, can also be beneficial in reducing the symptoms of OCD. A combination of therapy and medication is often the most effective approach. In conclusion, OCD is a serious mental health condition that can significantly impair an individual's life. It is crucial to dispel the misconceptions surrounding this disorder and recognize the profound distress it causes. With appropriate treatment, individuals with OCD can learn to manage their symptoms and lead fulfilling lives. Seeking professional help is the first step towards breaking the cycle of obsessions and compulsions and reclaiming control over one's life.